Good morning, everybody. In the last week, we had 750,000 people who came forward to get vaccinated in New South Wales, and we're inching ever so much closer to that 70% double dose figure, which is so encouraging. Can I please encourage everybody to come forward and vaccinated? And those of you who haven't, please make sure you book so that we can get to that 70% double dose as quickly as possible. To 8 p.m. last night, there were 1,281 cases of community transmission in New South Wales, and regrettably 5 people lost their lives, and we extend our deepest condolences to their loved ones. Late last week, I received modelling on when our health experts think the peak will hit in terms of the number of cases, what the ICU requirements might be, and what the number of people in hospital might be. And I'm pleased to say that today we'll be making all of that public, but I do want to qualify all of that to say that modelling depends on a number of things, a number of variables. And if too many of us do the wrong thing and there are too many super spreading events, we could see those numbers not be what they are. But I do want to stress the following, that today Dr. Chant will outline that we have 177 patients in our intensive care units with COVID. At any given time in our hospital system, there'd be around 400 people with non-COVID related issues in ICU. And so our surge capacity, including staff, in our intensive care units is 1,550. So just to give people that reassurance, we certainly don't want to have to use all those beds and that staff, because we know what a pressure it will put on the system. But I want everybody to be reassured that the capacity is there. And today I'm pleased to say that we have Susan Pearce, who's Deputy Director General of the Department of Health, to talk about those operational issues, and Dr. Nguyen, who is one of our specialists who actually put together the plan. To talk about the 18 months worth of planning that's gone on to ensure that we have a surge capacity of 1,550 beds in intensive care. All those figures are now publicly available, so all of our citizens can look at what we have today, what we look like, what we think we'll have. And according to the modelling that I've received, we're likely to reach a peak in cases in the next week or so. That's what the modelling tells us, and therefore a likely peak in intensive care beds required around early to mid-October. So that's what the best modelling tells us at this stage, but I do want to qualify that by saying that a number of variables are associated with that modelling. And I'm really pleased and grateful that Dr. Nguyen has made herself available today again to explain to us all the planning that's been involved, all the staff retraining, all the allocation of resources, and also a status report. Whilst things are stretched now, we appreciate they're going to have additional pressure put on the system in the next few weeks. And I just want to again thank all of our hospital staff, every single staff member, whether they're medically trained or otherwise, who keep our hospitals going in advance, as well as our ambulance and paramedic staff, who will be required to work together, as they do every day in our health system, to support the community at that time. But as Dr. Chant and the Minister and myself say almost every day, the best way we can keep people out of hospital, out of our intensive care units, is by getting vaccinated. And we've already seen what a difference vaccination makes. The higher the vaccination rate, the lower number of proportion of people who end up in hospital, and that's certainly what we'd like to see emerge in the next few weeks. So I'll ask Dr. Chant now to give the health update. Then Deputy Premier will talk about the regions. Susan Pearce from Health will talk about the operational changes or the operational imperatives that we've put in place to cope with the additional cases in hospital. And then Dr. Nguyen, as a clinician, as an expert, will talk about the plan and all that's gone into it to make sure that we have that surge capacity available. Thank you.